The most common way we take medicine is through the mouth, that is oral route. But you see, it's just more than just swallowing. Okay? The oral route is one of the most common mode of drug administration, and many people prefer to take their medicine orally as compared to injection. Others prefer the injection. But you know, the oral route is where a drug is swallowed, and then it directly goes into the stomach, where it will be absorbed, and then it enters into the blood. So the direct entry of the medicine from the mouth to the intestine is a very important aspect when it comes to understand oral route of drug administration, you see. However, this route also comes with a number of advantages and challenges. Advantage is it being so convenient. You don't need a nurse or a doctor to give you medicine orally. But it could be difficult, maybe for people who have a problem with swallowing, okay? Maybe the oral route for some tablets may not be convenient, maybe for children. That's why for children, we prefer to give them liquid, syrups, or suspensions. So the easiness, the convenience, it being painless, it being so suitable for long-term treatment, especially for patients with chronic illness, makes oral route very easy and convenient. But as I mentioned, if someone is having a problem in swallowing, okay, now oral route will be a problem. That's why maybe you'll find the doctor giving you an injection, or maybe you have a very severe infection, and you see the oral route takes time. First, the tablet needs to go to the stomach, then small intestine, then it enters the blood. So this thing takes time. So it may not be convenient when you are having an emergency condition. So that time, the best route could be injection. Again, for people struggling with stomach acidity, they might find oral route to be a bit of a challenge. The other important aspect which we can talk in the same oral route, which will affect drug administration, is the phenomena of what we call the first pass effect. You see, most drugs, as you give them orally, they will pass through the stomach, then to the liver. So the oral route is not for all drugs. Some drugs may find the oral route may be difficult. They might be inactivated when given orally. For example, you can see most of the protein drugs like insulin. You see, insulin, we don't give it orally, it's given by injection. Hormonal drugs like heparin, you see, it's given by injection because it will not be stable in the GIT acidity. Some drugs also could be destroyed in the liver. So when the gastrointestinal tract is a bit difficult for drugs to be administered orally, you'll find a drug to be preferred to be given by injection. The first pass effect, which I told, is also where a drug is metabolized or excreted or destroyed in the liver. That is why the whole amount of drug given orally may not reach 100% to the blood. Okay, that is what phenomena we call it bioavailability, which is availability of a drug in the blood. So the availability of a drug in the blood could be affected or may not be 100% when we give a drug orally. It does not mean it will have lesser efficacy. That is why in case of emergency conditions or in case of life-threatening conditions, that is why we don't go for the oral route. Rather, we prefer to go for an injection. The other route of administration, still in the same oral, is where some drugs are given under the tongue. This is called sublingual route. The sublingual route makes a benefit over the oral route because when you give a drug or when you put the drug under the tongue, remember, it will not go through the liver, so it will bypass the first pass metabolism, meaning it will have better bioavailability, you see. And it's also helpful for patients who have difficulty to swallow. It's again very useful in emergency conditions like in angina or in angina pectoris and related heart attack, or patients with secondary to myocardial infarction attack to administer like nitroglycerin sublingual tablets. Okay, so the idea with sublingual tablets is a tablet is meant to be placed just under the tongue. Also, we could have buccal tablets, and you'll be told just to keep the tablet in the buccal cavity. Just you use it just like candies. Okay, in all these three internal routes of administration, be it a tablet to be swallowed, be it a tablet under the tongue or in the buccal cavity, these routes of administration are in general referred as intral, and the medicines should be taken as is advised by the medical practitioner, and also listen to your pharmacist. So maybe if you are taking any of your oral tablet, sublingual, or if you are on any medicine and you need to talk to someone on the right advice, or if you have a question on whether a certain drug can be given with another one, or if you are taking multiple drugs and you are wondering if there could be interaction among those drugs, I'm available to provide you a medication review counseling service where we can go together your medicine list. We can try to evaluate their relevance, and I can provide you a very evidence-based information how best you can take your medicines and how you can get best out of those administrations. So in this video, we've talked about oral, sublingual, and buccal. Remember, when we say buccal, is just putting the drug in the buccal cavity where the drug will slowly be absorbed directly to the mucous membrane, to the blood. Sublingual, under the tongue, again it goes to the blood. It's quite fast, unlike the one you swallow and it goes to stomach, small intestine, and the liver. See you in the next video.